Well, public health nursing is unique among nursing disciplines because it's caring for the whole person in the context of their total environment. And whereas acute care hospital-based nursing tends to see a small segment of time with an individual, public health nursing is distributed over a longer period so that the professional gets to see more about how a patient or how an individual interacts within their home and really becomes well, and where healing takes place. They do a lot of teaching and they do a lot of work with families and individuals to help them. So public health nursing is forward-looking. It's very important arena of practice. Some even suggest it is the main place where nursing is practiced because by definition nursing is holistic, and that's what it can be when you're caring for people in the context of their whole environment.
Public health nursing is our nurses that serve our populations, whether through controlling communicable disease or working with low-income indigent populations on nutrition, physical activity, immunizations. I think they're there to serve the community, unlike a clinical setting which serves to help patients with acute care. The public health nurses really look at the whole of the population and work to improve the health through that avenue.
Public health nursing is an upstream nursing. It's more about prevention than it is about treatment.
Public health nursing to me means nursing that focuses on, this is going to sound obvious, but the public health. Things like communicable disease, things like hygiene, public education, making sure that people are aware of things that affect the greater public instead of focusing on just a couple patients at a time.
Here's what public health means to me. Safety.
Public health nursing to me means that when someone shows up and wants a shot, I can back off and say, not my job. But when someone calls with a complaint about a hoarding issue, all the nurses point at me and go, that's your job.
Public health nurses work with individuals, but their main focus is community health.
It is, I have to say, the absolute best profession there is in nursing, because primarily we in the public health departments are the only ones that deal with the needs of our whole entire population. We don't focus on individual patients that are in the hospital. We look to institute programs and policies and procedures that benefit the whole entire population. And we are actually the only healthcare entity that does look at population-based nursing as a whole in our programs. In my job as a health officer for Rusk County, I do have a lot of overlap with what I do with what a public health nurse does. Primarily in terms of our programming, in the position of having to investigate communicable disease cases and help prevent outbreaks, to assure that the public is healthy to the best extent that we can guarantee.